Hi, good evening friends. Welcome to our informative channel with Dr. Bhattacharya's Multi-Specialty Clinic. I am Dr. Avik Bhattacharya and I am a trichologist and a medical cosmetologist practicing in Kolkata with more than 12 years experience in this field. Okay, so every day we will just discuss some facts, some informative facts regarding your hair thing, regarding your cosmetic skin problems, regarding the treatment of aesthetic forms. Today we will going to discuss about a totally new thing which many of us don't know exactly. That is, though this treatment exactly doesn't come under any treatment pattern, but yes, of course, it is a treatment option for hair loss patients. Today we will going to discuss about cosmetic hair patch. Now what is this? What is this cosmetic hair patch? Who are the suitable candidates for that? How the process has been done? Everything will be disclosed. Just stay tuned and watch the video till the end. So basically, what is cosmetic hair patch? Cosmetic hair patch is a thing where there is a weak kind of thing or an artificial hair patch is attached with your scalp. Now, there are different patterns of doing the thing, like there is a clip system mode which will attach on your existing side bound hairs. There are another pattern to shave the rest of your front hairs, and we will attach with a glue, and that will be attached, and that will look like almost your normal natural hair. Now, this total process is termed as cosmetic hair patch. Now, obviously the next and most important question comes: why do we go for cosmetic hair system? Who are the ideal candidates for cosmetic hair system, right? So basically, if you go through the process or the thing exactly, who are the ideal candidate means there are some other treatments like cosmetic, cancer chemotherapy or radiotherapy. The patient who is undergoing for cancer chemotherapy or radiotherapy, and patients who doesn't afford actually for hair treatment, or patient where there is a limitation for the areas where we cannot do hair transplantation properly. They are the ideal candidate for cosmetic hair system or cosmetic hair patch. The patients who is undergoing for chemotherapy, cancer chemotherapy or radiotherapy, loses total hair, started losing and ultimately loses total hair in these areas. There is no permanent zone left on that area. So we will just, in that case, we will think of cosmetic hair patch. Another thing is that where there is limitation for hair transplant, patient wants to go for hair transplantation, patient willing to take hair transplantation, but there is limitation, like the permanent zone exactly doesn't exist, or maybe some very thinner quality and quantity of hair which will not going to make a good change for a patient's scalp, which will only cover the front areas to some extent, or maybe if we do some dispersed mode of hair transplantation that doesn't look good or doesn't make any change for patient's look, in that case the patient can undergo for cosmetic hair patch. So hair transplants limitation, the patient can go for that option. And lastly, the patient who cannot afford for the hair treatment like hair transplantation or some other modes of treatment in a package pattern like 6-8 sessions, we cannot go for and we cannot afford for that, can also avail the cosmetic hair system. Now, what are the basic processes of cosmetic hair system? How it has been done? The basic process is According to patient's facial scalp pattern, we will just take the amount or the directions of the facial scalp diameter of the total scalp pattern. We'll take the diameters and send it to the specialized persons, and they will make our artificial patch accordingly with the diameter pattern, and they will send it. And there are another also special technicians who will just fix it. They will the permanent hair, if it is present, that will fixed, that will cut in a manner. They will do a haircut, and rest of these areas here they will shave it off and apply a glue, specialized kind of glue, and they attached on the thing, and that will achieve. You can do hair combing, you can do hair shampooing, you can do hair oiling, color, everything like your normal natural hair. That just the only thing is that it will not grow out properly. It will not grow. And after a month you have to come for a maintenance. That means if the natural original hairs will started growing, they will just open it and they will do shampoo and shave it off, and again apply the glue and fix it on your scalp so that it will look as it is. And along with that, we also done haircut. You can do any kinds of styling. You can keep beard with that. You can keep your side burns long. Any kind of styling you can do with that. As a doctor, we do not tell the patient to go for that treatment because this is not a medical treatment. But yes, of course, that will be an option in cases of extreme cases where there are no options left for hair treatment, or when the patient cannot afford or go for the treatment. So all these things can be done for a cosmetic hair system. Is of course a patch, and we will do it here also. We have special technicians to do for it. Just come if you want to go for the cosmetic hair patch, or if you have. That's why we always we always advise you to take a proper consultation, to go for a trichologist, to go for a specially trained person who can properly elaborate what is exactly necessary for you and what you should go for, and we will elaborate like us. We will elaborate the thing to you, and if you want to go for it, you can go for it. So that is another option for treatment, or any kind of person who is exactly cannot fit in the treatment pattern or transplant. So that can be done in our clinic. There is also specialized person who will do the cosmetic. So that is just lastly but not the least, to conclude our discussion, just I want to say that always go for a person who is really trained, or who can only understand your needs properly, and who can only let you know the proper thing. Thank you. Good evening, friends, and keep watching for our videos, and subscribe my YouTube channels also for more videos. Thank you. Bye bye.